is body cavities and membranes. So the body has internal cavities that are closed to the environment, so they're not directly exposed to the outside environment. The cavities are going to provide different degrees of protection to the organs within them. The dorsal cavity is going to have a lot more protective function than the ventral cavity, but the ventral cavity is going to allow for a lot more locomotion than the dorsal cavity. So anyway, the two cavities are the dorsal cavity and the ventral cavity. And based on directional terms, you should have an idea of where those are already. But the dorsal cavity is going to surround the nervous system. It's divided into two subdivisions: the cranial cavity, that's going to encase the brain, and the vertebral cavity that's going to encase the spinal cord. So the dorsal cavity is a little bit towards the back compared to the ventral cavity. It's got the brain here in the cranial cavity and the vertebral column or the spinal cord within the vertebral cavity. I'm having a hard time speaking. If we looked at it from the back, we would see the actually this must be the front, because yes, this is a front view. Here's the cranial cavity, and we can only see part of the vertebral cavity because our other ventral cavities are shown there. The ventral cavity is going to house our internal organs, collectively referred to as the viscera. We'll often call it viscera. It's divided into two subdivisions that are separated by the diaphragm. So this is a physical division between thoracic and abdominal pelvic, that being the diaphragm. Within the thoracic cavity, there are two pleural cavities, each one around a lung. Between those is the mediastinum, which contains the pericardial cavity, we'll talk about in a second. And there's some other thoracic organs in there: the esophagus, the trachea, a few others that we'll run into through the course of the year in between the two lungs. And also in there is the pericardial cavity that encloses the heart. The abdominal pelvic cavity is actually two cavities: the abdominal cavity, which has the stomach, intestines, spleen, and liver, and the pelvic cavity that has the urinary bladder, the reproductive organs, and the rectum. But there is no anatomical structure that separates the abdominal cavity from the pelvic cavity the way the diaphragm separates the thoracic cavity from the abdominal pelvic cavity. We can get some first homeostatic imbalances here when structures stray into neighboring cavities. A hiatal hernia occurs when part of the stomach protrudes through the diaphragm and into the thoracic cavity. That could push stomach acid up into the esophagus, causing irritation that was commonly called heartburn, and it may require surgical repair in some cases. The ventral body cavity contains membranes, including serosa, which is a serous membrane. It's a thin, double-layered membrane that covers the surface in the ventral cavity. We'll also talk about this serosa surrounding individual organs. The parietal serosa will line internal body cavity walls, and the visceral serosa covers the internal organ itself, the viscera. So the parietal is further out, the viscera is closer to the organ. Those double layers are separated by a potential cavity, very thin, but it's still a cavity, that contains serous fluid, and that fluid is secreted by both of the membrane layers, and that fluid allows for reduction in friction, so these things can move around and we will not have we won't have pain from it, and we won't have as much awareness because they are moving around. They're lubricated, kind of like a coating of oil. Those serosa are often named for the organ to which they are associated with. So the pericardium is the serosal membrane that surrounds the heart. The visceral pericardium would be against the heart. The parietal pericardium would be against the wall that surrounds the heart. We do the same thing for the lungs, and that would be the pleurae. When we get to the abdominal pelvic cavity, there is a very large serous membrane called the peritoneum. That's going to take that job. So one way to think of a serous membrane is to picture yourself putting your fist into an underinflated balloon. Your fist would then be the organ that you're describing. The air between your fist and the outside wall would be comparable to the serous cavity, which would normally be filled with serous fluid. And then the outer balloon wall would be the parietal serosa. The balloon against your hand would be the visceral serosa. So in the heart, we've got a visceral pericardium. Visceral pericardium, fluid-filled space, and a parietal pericardium. So our heart is beating, and it's lubricated by that fluid. Serous membranes can become inflamed, so we've got our second homeostatic imbalance, second of many for this course. That can be the result of an infection. There are some other causes for that. So now the normally smooth layers start to get rough. They can even stick together, and that can lead to excruciating pain. Pleurisy, which would happen in the lung. Peritonitis would happen in the abdominal pelvic cavity. Every time you breathe in or out, the lungs have to rub against that resistance that's normally not there. The abdominal pelvic cavity is divided into quadrants and regions. Quadrants are the most common used divisions. Most primary care medical personnel are going to refer to to quadrants of the abdomen, and you would divide it into the right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. Again, I remind you, it's the patient's right and left, or the specimens. So here is our right upper quadrant. See the appendix, I believe, right there. The left upper quadrant, stomach takes up a lot of that. Right lower quadrant, we get to the intestinals, and the left lower quadrant, the intestines. Again, on the other side, also the descending colon and the sigmoid colon. And then this would be our prostate gland, as this would be a male patient. If you are in a surgical setting, or if you are in an academic anatomy setting, you're probably not going to use just those 4 quadrants. You're going to divide it up into 9 regions. Kind of looks like a tic-tac-toe grid. It would be the right hypochondriac, epigastric, left hypochondriac, right lumbar, umbilical, left lumbar, right iliac, sometimes called inguinal, hypogastric, and left iliac region. So if we look at those, right hypochondriac. So this hypo means below. Chondriac refers to the ridge, the rib. So this is just below the ribs. Epigastric is around the stomach, right here. Left hypochondriac is below the left side, below the ribs. Right lateral or lumbar, because you're in the lumbar region of the back. Umbilical region refers to the belly button. The right inguinal or iliac refers to either the iliac bone or the inguinal region. Pubic is right above or in the pubic region, and left linguinal and iliac, the same thing. The iliac crest is here, and that's also the inguinal region. There are some other body cavities that have smaller cavities that are exposed to the environment. The oral and digestive cavities, so that actually anything in your digestive system is outside your body. The nasal cavity, your eyes are in the orbital cavities. You also have middle ear cavities, Then the other cavities that we'll talk about more when we talk about joints and movement are synovial cavities. Those are cavities that make up your joints, spaces filled with synovial fluid, so that we can move our joints with relative ease. Okay, that wraps up Chapter 1. Thank you for your attention.